Welcome everybody to this afternoon's Muscles Matters 2021 online seminar on psychological support. My name is Bobby Ancil and I'm Head of Health, Service Development and Campaigns at Muscular UK. So building on the success of our 2020 series and having taken your feedback into account, the MDUK Muscles Matter seminars will become a regular feature in MDUK's calendar. They won't replace, but will run alongside our live events when we can host them again. You told us that you found the seminars helpful and informative, accessible and easy to attend, and they're a good way to bring our community together. So over the next 12 months, we'll run 2 or 3 seminars a month, focusing on a range of general and condition-specific topics. And they will include sessions you told us you found the most useful on research, practical and financial support, and managing your condition. Each seminar will include the popular question and answer sessions as we have today. Our helpline remains available to you and to anyone affected by a muscle wasting condition, and please do contact us if you have any questions or are in need of support. We can help you with information and can either support you directly or point you to where you can get support. The number and email address should now be on your screen. Do call us on 0800 652 6352 or email info@musculardystrophyuk.org. So this morning we'll be focusing on psychological support living with a muscle wasting condition. And we are very grateful to be joined by an expert panel covering a broad range of expertise on this topic. And before we begin though, I want to give you a note on how you can ask questions and make comments throughout this session. We have some advanced questions that have been shared already, and we will seek to cover these later. We'd also like to incorporate some live input. And so to do this, we'll be using the Q&A function. Please do type your question or comment and we will feed them into the discussion. To help us manage the technical side of the event, we won't be calling on questioners to ask the questions themselves directly. So any questions that we don't manage to don't know the answers to, we'll seek to answer them through our website afterwards. Finally, a reminder that we're recording this session and it will be made available over the next few days. So to start off this morning, I wanted to share with you some of the ways that MDUK has been striving to increase the mental health support that is available to people with a muscle wasting condition. So in 2018, we launched a report and campaign called Mental Health Matters. And alongside an expert steering group, we started a range of pilot projects to provide outlets and networks for people to access support. These included a virtual psychology clinic for parents of children with a muscle wasting condition, the expansion of our peer support network, a national campaign to increase access to psychological support at specialist neuromuscular centres, the development of a tool to help people manage their own health, known as a holistic needs assessment tool, psychology skills workshops for neuromuscular care advisors and nurses, more of which we'll hear about later. So without further ado, I'm delighted to welcome and introduce you to our panel for today. After I've introduced them all, I'll invite each of them to say a few words about their experience of mental health and muscle wasting conditions and the support that they provide before moving on to the questions and the further discussion. So first of all, Dr Jatin Pattni, trained as a clinical psychologist and has been working at the National Hospital for Neurology and Neurosurgery since 2008. He specialises in the neuromuscular service and has worked on at the Neuromuscular Complex Care Centre ward and the McArdle Clinic since 2013. Dr Pattni also chairs the Child and Young Persons Committee, which looks at improving and meeting the needs of young patients who attend the hospital. We're also joined by Andrew Robertson, who was diagnosed with limb-girdle muscular dystrophy in 1999. Andrew is the CEO of a family business employing 55 staff. He also works for the University of Kent in a partnership initiative, sharing his lived experience of disability with social work students through assessment, role plays and presentations. Andrew is a trustee for the Centre for Independent Living in Kent and for Enabled to Parent, a charity focused on disabled parents. He's also vice chair of the Physical Disability Forum in Kent and has been actively involved in campaigning side of work of MDUK, most notably our Mental Health Matters campaign. Andrew is also an MDUK peer support volunteer and offers his time and support to anybody with a neuromuscular condition that he often comes into contact with. There's a lot of stuff, Andrew. Maria Patasin. is a neuromuscular specialist nurse from the National Hospital for Neurology and Neurosurgery in London, and she specialises in myocardial related disorders and the adult transition services. Maria was trained and has worked in the Philippines before she came to the UK more than 18 years ago. Maria's clinical background was acute neurosurgery before she joined the specialist neuromuscular team in 2019. Pippa Jackson is a neuromuscular care advisor based in Sheffield, and she supports people with neuromuscular conditions in South Yorkshire and North Derbyshire. Pippa has been in the role since 2015 and is a physiotherapist by training, having worked the majority of her career in the community and specialising in neurological conditions. So first to Jatin, thank you so much for joining us this morning. Would you be happy to tell us a little bit about the importance of psychological support and neuromuscular conditions, and maybe even touching on the impact of the last year as we come out of lockdown?
Just missed that last bit. The importance of psychology in neuromuscular conditions, is that what you said?
Yeah, and maybe something looking at lockdown, if there's anything you can touch on there.
Absolutely. So, when we talk about a psychologist within a neuromuscular condition or neuromuscular services, or even in health in general, people often, the first thing people ask me, if they're not familiar with psychology, is, why have you got a psychologist within this kind of setting? And I'm not, there's nothing wrong with my mind, or I'm not mad, or any of those sorts of things, right? All those sorts of questions or worries. When we think about psychology within health conditions, we think about, when we think about health in general, health isn't just the physical aspect, i.e. the body necessarily, or the illness or the disability. When we think about health, we think about the social, as well as the psychological, as well as the biological. It's the interaction with that when we think about people's health and how people live in a healthy way, or how they deal with illness, right? So the psychological aspect, it can be very simple. In terms of we all get stuck sometimes, as we all do as human beings. We're creatures of habit. We can get stuck in ways of behaving, ways of thinking that are just we've developed over time as we're growing up. We get used to doing things in certain ways, and sometimes that's fine and it works really well, right? But sometimes those strategies, those approaches don't work so well, and we can get stuck. And in those situations, it can sometimes be helpful to have someone like me. But it doesn't have to be a psychologist necessarily. It can sometimes just be about having a space where one can think and reflect and review what one's doing. It's the same principle from healthy living. We talk about people exercising and eating well and those sorts of things, to actually health conditions that come in and challenge us. Health conditions are kind of special in a way, because of the effect they can have on us. It can be quite a profound effect. Even what sometimes, and what I hear from other, when the people I work with, my patients, they're told that either the condition isn't visible, like you look normal, you look fine, or that it's a benign condition, or it's one of the less the more benign conditions here, right? And what we forget is actually the profound effect these things can have on one's life. The many different ways it can interact in the social sphere as well as the psychological, right? And having a space to review that, think about that, can be helpful. Having a space to problem solve and work out specific strategies to deal with specific problems can be helpful, right? So that's how kind of psychologists can help. The help that's offered depends on the individual, and as I say, it could be anything from needing a space to review, think about and reflect, or it can be about working on specific problems. And sometimes people come to me when there isn't a sense of where the problem is, and the work we do is actually locating the problem. So it could be that there's a change in a health condition, or there could be pressures at work or in relationships, which it's kind of difficult to pin down when you're in it. And having a space with someone can help you kind of focus those, right? So these are the sorts of things that I do, and the work I do with people. There's always a question that comes up with what type of therapy and what sort of approach, should we be doing active? Some people have heard about ACT, acceptance commitment therapy. Should we be doing CBT? Should it be psychotherapy? These are kind of difficult questions to answer, really, in terms of evidence base. And I think what the crucial ingredients are possibly about the therapists themselves and the experience within health conditions, and you know, their knowledge-based experience and so on, right? But we can touch on those as we go along, or as maybe it will come up in this seminar. In terms of the last year, how can we quantify the effect and the challenges that the last year has had on all of us? I mean, it's been immense, right? In terms of the neuromuscular world, you know, people have had to deal with things like shielding and isolation that everyone's had to deal with, but possibly more so, right? But the challenges have been the same. So when we think about the last year with COVID, my view is thinking about it in terms of 4 stages, really. We had the kind of before COVID started, and we had all the warning signals, and everyone was worried, anxious, and so on. But we were also in a kind of heroic sort of stage. You know, we're going to get on with it, the blitz mentality, and so on. And then as that continued, we started to kind of think, well, actually, this is something that's going to change. It's going to be there for a longer while, and we have to now adjust to the new world. And I think that's where we're kind of at this point in time, you know, where we are all sort of facing the possibility of, well, what's it going to look like further down the line? What changes are going to be there for good, and what changes are maybe we can lift, right? And that's almost where we are, you know, where our governments are kind of pondering those questions as well, right? For neuromuscular world, I think the challenge is having, you know, been in lockdown and away, is how do you make that step back into the world? And possibly that's what we're seeing now more of, right? And again, as I said, we can talk about those if it comes up. But that's a kind of very broad kind of flavor of what's been going on in the past year.
Thanks so much, Jatin. That's fantastic. Maria, I think you work with Jatin. Is that correct?
Yes, I do. Yeah, I work with Jatin.
Would you be happy to tell us a little bit how your role fits into the support that you provide to people? Maybe share any things that have worked well in the past year?
Yeah, sure. Yeah. Yeah. So COVID has affected us in different ways. We didn't expect that after more than a year and a half, and despite of developing effective vaccines, national guidelines and restrictions and lockdowns, we're continuously finding strategies to restart to go back to the new normal way of living. It was a challenging experience to everyone due to the uncertainties regarding our physical health, then socio-economic and mental well-being brought by changes in our lifestyle. In our service, following government guidelines enables us to provide health information, which provides vital details on where to get help during the pandemic. We continued to do follow-ups with either telephone or video consult to ensure that we can support them and alleviate their concerns while shielding. However, we were redeployed to help in a clinical setting, but we still able to continue our services open to our patients. Examples are like we provided shielding letters, identified most of our patients to be included in a clinically extremely vulnerable list, and we worked with the GPs and other local government agencies, provided them with information about concerns regarding vaccinations. Majority of our patients' feedback informed us that they were very concerned of the effects or the complications of if contracted COVID, hence hesitancy to seek medical assistance and A&E attendance were low. They felt isolated, lonely, fearful, vulnerable because of lack of essential services locally. Examples were like carers were either reduced due to sickness or fear of getting the virus. The ONS found that 60% of the shielding group had expressed worsening mental health. However, 29% said that it was slightly worsened and 7% said much worse. So we all have different ways to cope with stress. Others may accept it positively or in a negative way. I guess this digital platform did play an important role to stay in touch with family, friends. Now that the government has laid their recovery plan, it's daunting, especially for our patients and family, to start the new normal. I think being aware, resilient, and having open communication are some of the key elements to overcome this transition. There are many platforms, either digital or starting plans, face-to-face programs to address these anxieties and mental issues. So I encourage our patients to be more proactive in taking back their independence by re-engaging or seeking support to friends, family, other health teams, or other local organizations. So we often mention and ask their mental well-being during consultation. Hence, this is a good starting point or opening conversation of awareness that help and support are available if need arises. Thank you.
Thanks, Maria. That's great. Can I move on to Andrew at this point? And maybe Andrew, you could say a few words about your own experiences, and then maybe touch on your work with peer support volunteers as well.
Sure, and apologies, Bobby, for the mouthful of the introduction. I'll try and do a bit less in future. But
you do too much, that's the problem.
Yeah. So I was diagnosed just over 20 years ago, and I'll never forget the words. It was a consultant that had recognised muscular dystrophy in their training, and he said to me, take away a couple of key points. First of all, there's no cure, there's no treatment, so you need to focus on your quality of life. There's a door, kind of good luck, and off you go. And then when I officially got diagnosed, I was still walking quite well, and I was told to come back if there were any problems. Went off to university, and then of course you're completely separate from your family, separate from your friends, dealing with a new condition, not knowing what the future holds, and there's that element of loneliness, that element of fear, and anxiety can come into it. How long have you got before you can stop walking? How do you plan for the future? And I remember kind of skip forward probably 10-15 years, being seen by a consultant who said, you have had some therapy, haven't you, to deal with it? No, I was kind of expecting someone to offer it, if I'm honest. And they said, oh, you seem to deal with it very well, so would you like some? Well, if you think I'm dealing with it well, perhaps I don't need any. And that kind of went on from there. And I suppose, for me, no one teaches you how to live with the deteriorating condition, the different milestones that happen. There's no one that will say, right, you know, now's the time to stop walking, now's the time that it's and how do you deal with that? I was fearful of losing the ability to walk for a very, very long time. And I'll never forget sitting in a power wheelchair for the first time and thinking, I don't have any pain, I don't have any fear of falling over. Can kind of go anywhere. This is revolutionary. This is I'd spent years kind of at home isolated because I was too fearful to go out, and it's those key moments I think that you really need support, but knowing where to turn is important, because I have sought support before from therapists that haven't perhaps understood disability, and that in some respects has made things worse. Life is complex, and you've got to balance the needs of yourself with that of people around you, such as family. And when you look at the initial statement, I was told quality of life is the most important thing for you. It's very easy with a disability and all the extra aids and equipment that you need. Life becomes too much about you and not about the people around you. And trying to get that kind of level of balance, I found very important. To start with, I was very embarrassed about the condition, and I didn't want people to see me struggle, so I'd actively avoid going places where people could see me struggle. And what I found, and to touch on the kind of peer support element, Bobby, over the years, when I speak to somebody else with the condition, and I've been doing it unofficially for a long time before working with Muscular Dystrophy UK, and you start to mention that a couple of the key things, like you might say to someone, I remember the feeling of walking down the street and being frightened of falling over if it was a windy day or if it was rainy. And they sometimes laugh, sometimes cry with just the fact that somebody else has experienced that. You might not have the answers, you haven't got the answers as to how to fix this, but the fact that somebody else knows what you're going through, has been through it and come out the other side. So when you do peer support, for me, it's as beneficial for myself as the person that might be hearing it for the first time, who might never have connected with anyone who's got those same fears and anxieties. And I have found some things that have helped over the years. I was part of the Actimus Acceptance and Commitment Therapy trial at King's, and the one little snippet I took away from that was a type of mindfulness called Leaves Down the River. And just thinking about, if you've got something happening tomorrow, you're going to a new place, and you might have checked out the accessibility as much as you can do, but you're still quite fearful as to what might happen. But those fears sometimes are irrational, but they can also be very crippling and then make things worse. So just trying to do a bit of mindfulness the night before, but equally doing the prep, doing the research, making sure that you know exactly what to expect, I think can be very useful. So hopefully that's, I haven't rambled on too much.
Not at all, Andrew. It's really, really helpful. Thank you. So the last panelist is Pippa. And Pippa, would you be happy to talk a little about some of the work that you've done to support people living with a neuromuscular condition around mental health, but also maybe touching on how you were involved in the MDUK Psychology Skills Workshop about 18 months ago, and maybe there's been a connection between the two things.
Yeah, thank you, Bobby. Right, so I'm a physio by training, and always had a huge interest in the link between mental and physical health, and the way that somebody's physical and mental health impact on each other. And that's probably kind of what led me to down the career path to be a care advisor. And I've had sort of some input with psychological support with patients all the way through my role here for the last few years. But usually it's just been about signposting, either to general counselling services or to more specialist neuropsychology or community therapy teams with psychology input. And I do that kind of every so often. A patient would come with some of the issues, perhaps like Andrew described, around getting their diagnosis, coming to the milestones of mobility needs changing and that kind of thing. And then COVID happened, and patients were completely isolated, and society has just been through a horrendous time. And coming out of the other side of that, my role has really changed. I'm providing much more in the way of time to listen to people, hopefully trying to give them a space to explore the difficulties that they've been through, and prioritise really what's going on for them. They've been through really significant changes in a really focused period of time, and they might be experiencing an acceleration in their symptoms because they've been stuck at home and they haven't been going to work or to the pool or whatever was their normal. They are experiencing higher levels of pain and fatigue because they're less busy and less occupied. The family support has changed. They may have been bereaved. They've been away from work and then on furlough and then had to go back. And young people as well, people who've transitioned. It's just, there's a whole spectrum of problems that people are needing support with that they were getting that perhaps elsewhere before COVID. My role has definitely changed as a result of the pandemic, and also the way that I deliver my role has changed. So before I would be in the clinic and be available to patients when they came to see the consultant. So hopefully it wasn't happening, Andrew, like you experienced. You saw the consultant and then got shown the door, and they would be able to come and see me and have space to talk things through when they receive their diagnosis. And we've had to stop that, unfortunately, because we just don't have room in the clinic space at present. So I'm providing most of my support on the telephone now, which has its pros and cons, really. You can provide support to more people more directly, but it's not the same as face-to-face. So that's been a big change to deal with. And the sort of signposting and referring, I've tried to be a bit more specific, really. So giving patients an idea of where they can ask for support, what areas of life they can ask for support around. And the training that I received from MDUK about 18 months, really well timed in terms of just before a global pandemic and all these problems have arrived for people. But it's been really helpful in helping me to focus the support I provide to patients. So we covered things like the different types of therapy that are out there, and a brief so I've got a brief knowledge of things like acceptance and commitment therapy, CBT, mindfulness, not to deliver those therapies to people because I don't have the time and the resource to do that, but to identify that might be an area that would work for you. This is something that you could ask for in your referral. The other sorts of things that we covered in the training was around living with a long-term condition. So sharing experiences from other care advisors on patients that they've supported, understanding people's coping mechanisms and how different personality types cope differently, understanding dealing with a progressive disease, and reaching those milestones and that sort of thing. We worked on empathy and listening skills, active listening, and again helping patients prioritise those problems that they're experiencing. We looked at boundaries and expectations. So I think that's important when you're offering somebody a listening ear, that they know how long you've got to listen and what you're able to provide for them. And so we explored ways of communicating that to patients, which has been really helpful. We looked at the holistic needs assessment and worked on adding different areas of questioning to that, which was again really helpful. We looked at risk awareness, so supporting patients who are really in high levels of distress around their mental health, and how to support somebody over the phone or face-to-face who's experiencing really significant problems. And we looked a bit as well at behaviour change and motivational interviewing, and I've shared that with my physio colleagues as well, because a lot of their work is around helping people to form good habits in terms of exercise, and so we shared that as a team separate from the training, so that was really helpful. And just lastly, the other thing that we looked at as a group was around self-care, which again over the last few months has been really invaluable to support each other as a team working with the patients, but also as a wider care advisor community, and knowing to look after yourself really. If you're providing psychological support to patients, it's really important, and it's definitely helped me cope with the whole pandemic experience and everything that sort of the world's been through really. So no, the training was really helpful, and the only kind of negative is that we haven't been able to sort of meet up again since to sort of share how we've used it as a group of care advisors. But yeah, that's okay.
Thanks so much, Pippa, and thank you everybody for your opening comments. Really great, broad, able to cover many topics. So if we move on to the kind of the questions and answer kind of discussion section of the session, we've had a couple sent through during the past 30 minutes, and if you're comfortable, I'm going to read the question out and then maybe see who jumps in first, or if you have a response. So somebody has written, my nephew is 9 and last Monday was confirmed with a diagnosis of muscular dystrophy, and been told that they're going to be unable to walk by the age of 17. What can I do to support him and his family, my brother, sister-in-law, and older nephew who is 17? I don't live near them at the moment, and at the moment we're all just shell-shocked by this news. So is there anybody like to come in on that one about supporting a kind of your family when you receive news of this sort? Jatin, would you like to go
yes,
first?
Yeah, just seeing who wants to dive in. I mean, I think what the first thing we need to understand is just you know, how is this information absorbed in the system by the individual, but also the wider system, right? You know, when we think about news like this, which is bad news, right? I think it's safe to say this is not something that people want to hear. And what do we normally do? Our normal response, first to disbelieve and be in a state of shock, right? And then the kind of adjustment to and thinking about it. I would say, you know, the recency, if this information's just been received, I think the best thing at this stage is that what we call kind of psychological well-being, you know, or first aid. You know, it's not about intervening or necessarily doing anything, but about being there and providing a space and allowing for that natural process of shock, disbelief, mourning, all those sorts of things that have to be gone through to happen, right? So at this stage, just being there. Further down the line, you might want to think about both as an individual. So if you're not a part of the family, just being there, I think, and being a space or an avenue of support. And it doesn't have to be practical. It doesn't have to be doing things. It can just be being there, you know. But further down the line, you might want to then think about, or the family might want to think about how they support that young person, but also themselves in terms of preparing for and managing those transitions. I mean, you know, that message, which, you know, I guess other people, you know, it's one that's common and people have heard before. I've certainly heard people talk about this when I've seen them as adults, that you're not going to be walking at 17. That's a tough thing to swallow, isn't it? For anyone to be given that information. I think it needs processing and it needs better understanding about, you know, how that message is given and what it actually means, right? So I think there's work to be done further down the line. There's services, I would say, that are out there, definitely, especially for young people. There's very good services, right? In terms of pediatric services, in terms of the you know, the therapy services for young people. So there's a lot out there. It's about kind of getting the access when you need it, right? But at this stage, so early, I think, you know, it's just about absorbing the information first. That's fine. Is that okay?
Thanks, Jatin. That's wonderful. Anybody else like to step in? Andrew?
I could give the kind of patient's perspective, because I was told a similar thing, but I was a bit older, so I was 19, and I think you're exactly right. It took me a few years to really absorb that information before I started to work out how I was going to plan for the next step. Now, I probably did it all wrong in that I was out there wanting to do everything in life before the wheelchair came, and was actually probably sped up the progression of the condition. I was working 7 days a week, really trying to get everything done and prepared, buy a house, you know, within a few years, finish university, just everything was done quickly. And I look back on it and I think if I'd perhaps known that the wheelchair, the stopping walking wasn't the end of life, it's just a different way of life. And as soon as I could accept that, I could learn to live with that knowledge a little bit more comfortably. And I never did. So I was never comfortable the entire time up until using a wheelchair. I was always fearful of that next step and doing everything possible to try and prevent it. But just towards the end, I started to go out there and look at other groups of disabled people and try to see, how do people in wheelchairs cope? How do they integrate with society? Let's go meet a couple. But it took me a few years to be brave enough to do that. And when I did, I got, yeah, it just helped, I suppose. And that wasn't really directly peer support. That was just socializing with people that are in wheelchairs. I was a bit like a stalker. I was on university campus looking at anyone. Oh, there's a wheelchair. You're right. Let's go find them, pounce on them and ask them, how do you do life? You know, what do I need to know? What do I need to prepare myself? But it definitely took a bit of time before I was ready to do that.
Thanks, Andrew. Pippa or Maria, would you like to add anything to this?
Yeah, I can. I mean, I just support adults in my role at the moment, but I did work with some paediatrics and families previously, and I would just encourage the family to engage with the team that have made the diagnosis and that are going to be providing care. and speak to your care advisor or your specialist nurse, and kind of find out what you need to know about the support that's out there at whatever stage. So like Jatin said, you'll have different needs as you go through the journey, and just making sure you're linking with the team as much as you can, and try and access that support, and also access as much support as you can in paediatrics, because it reduces when you come to adults. And then also use peer support network as well. So there are lots of ways of networking with other families and linking in with that. And again, at this early stage, they might not be ready quite for that, but it will probably be helpful, you know, further down the line.
Thanks, Pippa. Maria, is there anything from your perspective?
Yeah, I do agree with everyone. I think just awareness and knowing your resources, and making a contact with your specialist team or other organizations for you to be able to help the family go through with the condition.
Can I just add one other thing, Bobby, just following on from Andrew? You know, I think the message we want to get out is that there is a life to be lived here. You know, it's not the end, and I think it's really important that we kind of, you know, have that in our heads all the time, right? You know, the fear, the dread is that this is a sentence, if you like, and it's the end, and it does mean, you know, it will mean certain changes, but there is a life to be lived, and that's the message I try and get out with everyone, young people as well as older, that there are things that can happen.
Fantastic, thank you. Just one thing to maybe consider at this point is that there are, MDUK has groups that we have the peer support network, and we also have muscle groups, which are support groups that take place around the country and currently are online, and that may be something that you want to look into, but it might also be worth talking to the care advisor or suggesting if this is the right time for that. So we've got another question that's come in, and it's somebody who's wondering about what support is out there for parents of newly diagnosed children with Duchenne. They are currently struggling to find much that is out there. So there was a particular focus on Duchenne, but maybe thinking about anybody who's got a child with a new diagnosis that's got a neuromuscular condition. Anybody, any ideas for that, for this person?
I think so. May I? I mean, in terms of young, again, these are recent diagnoses, I guess, or dealing with someone who's just been given, you know, who's got a neuromuscular condition in that age bracket. I think that there's services, again, what people were saying, and Maria, that, you know, there are well-established, really good services, I think, on the whole, within child services, and you can tap into that kind of support at many different levels. So that's what I would be thinking at this stage, right? Yeah, so school, you know, the advisors, the support in school, the pediatric services, the community nurses, all those sorts of avenues of support, I think. But this isn't my area, so yeah, you know, child is definitely not my area, so I'm not familiar with what's out there necessarily.
Anybody else on that particular point? Because I think it does. It's not dissimilar to the previous question. So, Pippa, if there is something you'd like to say, please do.
I think it's just to echo that. Really, is just to say, you know, speak to the team rather than trying to kind of wade through Google and Facebook groups and things at this stage. Go back to the clinical team and speak with them and get them to signpost you to local support through school and social care. So if there's kind of any problems around sort of managing behaviour or managing at home, coping with siblings, that kind of thing, then there might be local support through the local children's hospice or through social services. There usually is what's called a multi-agency support team for families, and they can provide help at home with managing behaviour, coping with cooking meals, any aspect of parenting really that family might be finding challenging, particularly in that sort of circumstance. So I think if you go back to the clinical team or school and ask there where there's expertise on the condition and on their child, then that will probably be the best place to start.
Thanks, Pippa. You may have noticed I'm staring at the screen. I'm reading through lots of comments and questions coming in now, which is great. And I'd just like to read a comment from somebody who's kind of responding to the first couple of questions we've had, and they've said, it's Julie, and she said, receiving my diagnosis of limb-girdle muscular dystrophy was heartbreaking. Deep down, I've not really ever come to terms with it. I was told I could be in a wheelchair in 5 years, and the consultant had no idea of my future. 26 years later, however, I'm not in that chair. I use a crutch, a frame, but do not use a scooter when we go out, as my walking and strength now is not as good as it was. It's an incredibly hard journey, but keeping fighting, keeping strong mentally and physically as much as you can. And I want to send my best wishes to everyone on this session. So thank you, Julie. I have a question here from Dean, and it's as follows. I have 2 daughters diagnosed with limb-girdle muscular dystrophy, and they're aged 17 and 22. It's been difficult to get psychological support or know where to begin. In particular, my 17-year-old has found it difficult to acknowledge or talk about how she feels. The main issue is someone who has an understanding of what she faces. Many of the challenges and fears that Andrew has been talking about resonate with how she behaves. I would be grateful for any practical advice as she finds it hard to talk to her dad. Andrew, maybe is that something you could?
Yeah, I'd probably say if I was back in that time now, connecting with a peer support volunteer is a big first step, because you're talking to someone confidentially who's been through it. And even if they haven't got the answers, even just to be able to listen and to say, you know, I've been there, I understand it. I would say connect with Muscular Dystrophy UK and get it onto a peer support volunteer. There's quite a few of them, and other than myself, I could recommend all of them. They're very good.
Anybody else would like to come in on that particular points about Pippa?
Yeah, I don't know obviously where you're based, but again, most places will have a local service supporting young people in terms of mental health, not a sort of formal clinical counselling or psychology service, but a young person's service, perhaps linked to maybe careers advice. That's what we have in Sheffield. And although those workers won't necessarily have knowledge of disability, they will have knowledge of teenagers and young people, and those aspirations being altered and changed from what perhaps your daughter had been planning and that kind of thing. So that might be somewhere to look for help. But again, your sort of local team will be able to advise you on specific services that there are around you. But absolutely, peer support, I think, is probably the best place to get that sort of lived experience. I think that would be really valuable.
Maria, were you trying to join in at that moment?
Yes. I would just like to add, with Pippa said, they have to make contact with their peer group, and there are other services around the country where you can be able to join in, especially with the young adults. It's very difficult to speak to parents, so it's much better if it's going to be your age or other who has a specialist in the area. In the National Hospital, we do have a young persons group, which is run by Dr. Pattni, and mostly it's just social conversations with young people. So I guess maybe there are other centers who do the same, so they can get in touch with a young group. Yeah.
Lots to dive in there. What I would say, so it's tricky for all those things that everyone said, but for parents, it's really difficult, isn't it? It's like, how do you position yourself as a parent when you see your child obviously distressed, or maybe not so obviously distressed, but you're worried, right? So where do you position yourself, and how do you do it? And I sometimes think a parent's role here is like a coach. You know, you've got to be on the sideline. Sometimes you can't intrude in for the reasons that other people have said. Kids don't necessarily, particularly 17-year-olds. Thinking about my own 17-year-olds, would I have spoken, as in when I was 17, would I have spoken to my parents? No way, right? I think, but actually they need to be around. That's the important thing. As a parent, sometimes you need to be around. You need to stop them if they're going to run across the road. You need to put in the hard rule. That's just no, you know. And so knowing where that line is, but sometimes you need to let them make mistakes, do the wrong thing in your view, but not necessarily theirs, because they're their own person. You know, people have to make that mistake. So it's about being on the side, making sure it's safe. You know, if you're really concerned, GPs are really, really helpful on the whole, right? You know, you can always call them, you can always speak to them. You know, they can't break confidentiality necessarily, but they can still kind of make the calls or intervene, you know, in a more discreet way, or advise you where you need to go and what you need to do. But it's holding that position. So being there, allowing them to have their moment or to be distressed, but making sure all the other things are in place, you know, through safety, all those sorts of things. It's a tough position, right? Not easy, but that, yeah. So that's maybe the position you want to take on, a little bit like a coach, right? In terms of the young persons group, thanks Maria for mentioning that. It is something that we ran. And you know, it's quite hard to recruit people as well. You know, people are very nervous and kind of shy about coming to these sorts of groups. So it's just keeping that in mind, you know, how you kind of lower the threshold, maybe helping people take a chance, like Andrew was saying, and going out there. But it's also about timing as well.
Thank you, Jatin. I noticed there's we've got about 13 minutes to go, so I'm going to try and get a couple of quick questions in, and then I know I've got a few comments from people who've been adding to the chat. So here's a question: do you have any suggestions for carers of an adult man who avoids and is resistant to any professional peer involvement? Tricky one, perhaps. Anybody who, I don't know, Pippa, maybe it's something that you've experienced in the past.
Yeah, it's not a given that patients want your support or want to engage with other people. People can be very fixed in their ideas. And maybe it's about the carers of that person getting some support for themselves, having some conversations in a safe space around understanding their partner, if that's the relationship, and understanding themselves and how they react to their partner's, you know, fixed tramlines ideas, and you know, learning strategies to cope with that themselves as a carer. And also getting some support as a carer as well, so having a break and accepting that if somebody's, you know, got the capacity to understand their condition and understand the impact that engaging or not engaging will have, that they're free to make that decision, and that you can't, you know, carry that yourself. It's providing that, yeah, maybe getting some support for the carer themselves, I think.
Thanks.
I certainly echo that. I think sometimes it's too easy to get caught up in how you're living your life, how you're dealing with the condition, how you're facing the day-to-day struggles, and the wake of destruction around you can sometimes. It took me a long time before I was really made aware of that, and yeah, it's very difficult to how you would then, if I look at myself and go back in time, how would you politely tell someone that they need to perhaps look at the way that they're conducting themselves? But yeah, I'd certainly say that the carer is getting help for themselves if the individual isn't prepared or isn't wanting to take that step.
If everyone's happy, I'm going to move on to a couple more questions just to make sure we try and fit them in. So someone here said, I'm 62 and have had what I know is spinal muscular atrophy since birth. My condition is deteriorating and I get frustrated with things that I can't do but want to. I've been very anxious about things that are going somewhere new. For example, where can I park? Is there a disabled toilet? And I suspect I have mild to moderate depression. My frustrations have got worse recently, maybe because of COVID, but my physical capabilities have reduced and I'm not coping with it very well. What would the panel be able to advise for me to do? Anybody able to share some thoughts, maybe a reflection?
I could perhaps jump in because I remember having those fears about going out. and it took a lot to push me, especially to get a train. So I've been told years ago that as a wheelchair user, getting a train is stressful, it's difficult, there's lots of reasons not to do it, lots of reasons to be anxious. And by properly kind of researching and making a very small steps, so an easy journey to start with, and then getting really confident doing that one journey straight down, only a couple of stops to get off, and then getting really confident and then building up to more complex journeys. But in the early days, the push for me was my son. I wanted to take him on days out into London, and that really drove me into, I've got to be confident with this, and I can't appear to be unconfident around him. He's only, at the time he was 4 or 5. So really kind of building up the confidence, doing the research, letting other people know this is the plan, this time I want to go here, and then we're going to go here, this is how long it'll take, this is the train we're going to get back, this is the one we're going to get if we're not going to make that train. And having that plan, and I was very kind of, I had alarms going off, right, time to leave this museum, off to the next one. It was very regimented, but that gave me some safety, that gave me some structure. And then fast forward even a couple of years, I'm going on days out with virtually no plan. I know roughly what train to get, roughly what train to get back, going to get buses, but it took a long time to get confidence. I wouldn't beat yourself up about the difficulty. It's, for me, making small steps to start with, really planning, over planning, and having a backup, and knowing that it doesn't matter if you go somewhere and then you have to come home. It's not the end of the world. You can try again. But sometimes you can build things up too much in your mind, and then it makes it more difficult to actually go and do it. So for me, just getting out there, small steps, lots of planning, and the ability that if things don't go right, which they're not going to all the time, how you react and then deal with that without losing the confidence to do it again. Hopefully that's helpful.
Excellent, Andrew, thank you. If everyone's comfortable, I've got probably one last question and a few comments to read out, if that's okay. And hopefully it's a good one to maybe get close to the end on, is what 3 specific psychological tips or practical takeaways, if you will, that adults with MD can employ to help them? So what 3 tips would you give to people or practical ideas to try and live with your condition, particularly maybe at this time coming out of lockdown?
That's a tough one. What would maybe one each? I mean, I think it's knowing yourself, really. It's understanding, and often when we get stuck, we life moves really quickly. Everything has to be done in a rush. A bit like Andrew was saying, we have this, things are just changing and going on and on, right? And I think having the ability or giving yourself the time to slow things down and actually reflect and think about stuff, right, is possibly the most helpful thing you can do. That you can either do it on your own. People keep logs, diaries, things that they've done, things that they've done well, but also their dreams and aspirations. What is it? Where do you want to go, right? But giving yourself a space and time to kind of think about that and reflect on it, and what went wrong, what was hard, and so on. Is a really useful kind of technique to use, right? And there's a wealth of sort of techniques and books and self-help sort of approaches that you can draw into. So I guess the other thing is to remember that you're not alone. There are people out there with illness, and can often make us feel quite isolated, right, and quite alone. We think we're doing this on our own. All those sorts of support groups, but also anything else in your own history, it's all there to help you and support you. So reminding yourself that you're not alone. So that's 2 I've got. I can't think of a third.
Thanks, Justin. Getting to 2 was pretty impressive. Maybe if Andrew, do you or Pippa or Maria, please jump in. Pippa, I can see you've come off mute.
Yeah, I would say communicate, talk to people, whether that's your nearest and dearest at home, whether it's a trusted friend or colleague or your clinical team. Make sure that you you understand your experience is valid. Just because everybody's been through the pandemic, it's a very strong feeling that, well, everybody's been through this, and just because I feel rubbish, everybody feels rubbish, so I shouldn't bother anybody. I have a lot of patients saying that kind of thing to me, and that's not the case. Everybody's experience is valid, and you deserve to be listened to, and you know, you should communicate to people how you're feeling, and that then can, you know, help with problem solving and kind of, you know, finding ways to help. The other is, with my physio hat on, is to think about some sort of activity and exercise that you can enjoy and get absorbed in to your level, in safety, and that will be different for everybody. And again, your clinical team can advise. Most clinical teams have access to specialist physios who understand exercise with neuromuscular conditions and can give you something at your level that you'd be interested in. But it's also thinking about different sorts of activity, anything that absorbs you, that you can get kind of a bit lost in, that can really help your psychological well-being as well. So that's my two. I couldn't think of a third.
Andrew, do you have anything to add, some tips?
Yeah, I think just don't take life too seriously. You know, it's serious enough without you overthinking it within yourself. And I'm very lucky having a young child where you have to kind of make things fun. You have to kind of play around with the wheelchair and the mobility issues, and just try and get out there and do as much as possible. But also not taking things seriously. Sometimes things won't go right. And I remember once being told not to plan too much, be more spontaneous. So I was on a day out and we thought, oh look, I can pop into this particular museum, the Waxworks. Got there, hadn't planned it. They only let 3 wheelchairs in, and there was already 3 in. So no matter how much you argue that it's unfair and everything else, you weren't getting in. So okay, we'll get back to the station, and then we waited for bus after bus after bus that wouldn't let us on. And after 4 instances of the buses not letting us on because they were too busy, it was particularly a difficult day in London. I'm thinking, right, okay, I need to make this fun, or this is going to end the day on a real downer. So I put the carer on the next bus and said, right, we're going to race you. My son sat next to me, he operates the horn on the chair, and we're going to beat the bus to St Pancras if it kills me or whoever I run over. And just that element of taking a bad situation and saying, right, how can I put a spin on this? How can I make this fun? It's not just me, it's my son. But if I've gone down in the dumps back and thought, oh, the buses haven't let me on, I haven't got in the museum, I've tried to be spontaneous, I'm going to feel so terrible the whole way home. But actually, I've come away feeling quite proud of myself that I've taken a bad situation, made it fun, and we beat the carer. I was not going to let that carer beat me. Traffic was bad as well. Yeah. So I think just don't take life too seriously. You know, that will be a key takeaway.
Thanks, Andrew. And Maria.
Oh yes, yeah. Like what I've said earlier, is being aware and resilience, and an open communication with your team, specialist team, and other organizations that can be able to provide help for you. And also, everyone is undergoing this, so you're not alone. Always think that there are other people who's ready to help you to overcome this anxiety.
Thanks so much, Maria. Okay, so just a few comments that have come through the chat. So there's something from Philippa Farrant. I think she'll be happy for me to share her name. And she said, we need a bit of everything. There will be times when we need the likes of psychologists like Jatin, but linking with the neuromuscular team for the care advisor, but also the peer support is absolutely vital. We know how hard it is to access specialist services. And Julie, who spoke, who commented a little bit earlier, said, thanks. So, sorry, as well as support groups, I'd be happy to help the young person who had a question earlier, and we can link you up later, potentially. And it's so incredibly important to speak to people who are going through similar mental struggle. One last comment from Michael. He says, thank you so much to every panel member for the incredible support and the work that you do to continue to give, especially during these testing and uncertain times. And Dean says, thanks so much for all your advice. So I think we can safely say that everyone is very grateful for the past hour of your time and input and expertise. But unfortunately, that is the end of today's session. And I'd like to thank you again, each of the panelists, for giving your time and for all of the things that you've shared. And one final reminder that you can see the recordings of this session and all other Muscle Matter seminars on the MDUK website. And it will be this session will be posted on the site later today, we hope. And hopefully your feedback will be really invaluable in how we can shape these sessions as we go forward throughout the year. Okay, finally, thank you very much for joining us, and hope to see you again soon. Thanks.